While we continue our coverage of the coronavirus, as well as that developing story that is currently underway at the OR Tambo International Airport, where 121 South Africans who are in Wuhan will be repatriated. The aircraft is expected to leave at around 9 o'clock later on this evening. But still sticking with the story of the coronavirus, HIV and TB sufferers not on treatment could be at risk if they contract the coronavirus, although there's not really enough information about how HIV-positive people and TB sufferers could be affected. Experts say those compromised immune systems could be at risk should the COVID-19 spread. To discuss this, we are now joined in studio by Professor Shabir Mahdi, who is from the National Institute of Communicable Diseases. Professor, good evening and welcome to The Full View. Let's first start off with this developing story that we'll be speaking about this evening. What does this moment mean for South Africans, especially those 121 South Africans who want to return back to the country?
So good evening. So just a correction before we start. I was at the NICD. I'm no longer at the NICD. I'm at the University of Witwatersrand.
Okay, apologies.
So in terms of what we see transpiring right now, and in terms of the plan of repatriating the students from Wuhan, the manner in which it's being done is highly responsible. There's no better way in terms of manage the repatriation than what is being done at this point in time by the Department of Health, by the government. And the reason I say that is better knowing what is coming your way than not knowing what is coming your way. So as an example, the group of Italians that came back to the country, they didn't go into quarantine immediately, and hence they ended up manifesting symptoms, and it is possible they may or may not have infected other individuals. In this particular instance, what we've got is we've got a very controlled situation where the students will be coming back and they will be placed under quarantine for at least up to about 2 weeks, during which time they'll be monitored to determine whether or not they manifest any sort of symptoms of a respiratory illness, and if they do, they obviously would be investigated. But the important thing is that they're not going to be let loose into the communities, and they don't pose any risk to anyone in South Africa being in quarantine. So I don't think there's any need to actually be concerned with the repatriation of the students. It is a highly responsible move. I think it's necessary for the students to come back because they obviously have been under tremendous emotional stress.
Sure.
They are wanting to come back, and the manner in which it's being conducted, I think it's the way to go.
And just finally, what would the normal process be to quarantine a number of people who are up to 121? Because what we've heard from the department is since the arrival, at least of the group of 10 from Italy, that they've been encouraged to self-isolate as a method of trying to control or contain the spread of the virus. Correct. While the tests are being run.
Right. So in this particular instance, I'm not too sure exactly what the Department of Health and what the government has planned in terms of where the students will be placed. In all likelihood, it's probably going to be some hotel or some resort type of a facility where each of them would have their own individual rooms, and the people that would probably be serving them food, etc., would have been trained in terms of how to actually engage with the students. So I don't know the exact specifics in terms of what is planned, but I would imagine that is exactly what would probably transpire. It would probably be difficult for these students to self-quarantine at their own homes, because obviously they live in communities which are possibly crowded, the households are really small, and they're going to come into contact with other individuals in that particular household. So the only way to be successful in terms of quarantining these students is for there to be a specific facility which is dedicated for them to reside in, at least for the next 14 days.
Let's then quickly speak about people who are at high risk of contracting the virus. I know that in the introduction we spoke about HIV-positive patients as well as those who have been diagnosed with TB. What about people who are more older?
Right. So I think there's sort of a grading in terms of what we call a case fatality risk. And what I mean by that is that when someone becomes ill from this coronavirus, we call it a COVID case, a COVID-19 case. Now, what we do know of the individuals that develop illness from this particular virus is that if you're completely healthy, you're under the age of 50, you've got no underlying medical conditions, no comorbidities, your risk of actually dying after developing disease from this particular virus is actually very low. It's about 1%, right? If you're an individual over the age of 50 and you've got heart conditions, right, that risk actually jumps up to a 10% case fatality risk. So someone that's got heart problems that develops an illness from this virus, there's up to a 10% chance that that individual will actually die. If they've got chronic lung diseases, that chance is at about 7%. If they're over the age of 70, and this is what Italians are facing at the moment as an example, then that risk of dying after developing illness from this virus goes up to around about 14%.
That's what we saw in the USA as well with the old age home.
Correct.
Yeah.
So it's a very high risk especially over the age of 70, which goes up to 14% compared to a general population risk of roughly about 1%.
And what is it about them in the immune system that makes it more susceptible?
Right, so there's probably a number of factors at play, and what it really is all about is that when you develop an infection from this virus, your body obviously mounts an immune response. And usually that immune response is sort of very regulated and measured in terms of how it responds to the virus. What happens the older you become is that your immune system becomes weak, and there's sort of what we call a dysregulation of the immune response. So the body doesn't know when to stop producing sort of fighting of that infection. It sort of, in a sense, overreacts. And there's this imbalance that happens in the immune system which results in very severe disease in people that are very old, as well as other individuals that have other sort of underlying medical conditions. So it's sort of an imbalance in terms of the manner in which the body actually reacts to the virus that causes a severe disease that we observe that results in this difficulty in breathing and failure to be able to oxygenate.
And how does that grading apply to infants, for instance, as well as more your children, as well as those in adolescence as well?
Correct. So surprisingly, infants, children have not been that severely affected. They have become infected. The chances of a child that's exposed to an adult that's shedding the virus or becoming infected is the same as an adult that's exposed to that adult. So there's a similar chance in terms of becoming infected, but they don't end up developing severe disease. Right now, we don't know the exact reason why they don't develop severe disease. There's a number of different hypotheses which have been put forward in terms of why children might not be developing severe disease. And I don't want to speculate about that. It's a bit technical in terms of the reasoning. But it's safe to say that young infants, children under the age of 12, under the age of 18, in fact, they haven't actually manifested much by way of severe illness following infection with the virus.
And just to emphasize a message to the public, what should they be doing?
There's two things that they should do right now. The first thing is that the WHO has emphasizes, and I think all of the experts have repeatedly emphasized this, and the way to avoid getting infected with the virus is to make sure that you're indulging in hand hygiene. Wash your hands regularly when you come into contact with foreign surfaces that you don't know may or not have been contaminated by droplets from someone that might have been infected. So washing hands is absolutely important. The other important thing is don't panic. The panic is creating more problems. This is becoming a pandemic of panic more than anything else, right? And it's something that we need to be guarded. The type of mortality that we're observing with this particular virus is not that high. Even though there's large numbers of people that are becoming infected, right? Those large numbers pale into insignificance when you compare to the number of individuals that will become infected with influenza virus this year. Globally this year, roughly about 280,000 people are going to die from a viral infection, which is influenza virus. In South Africa, between 4,000 and 10,000 people are going to die from influenza virus. Right? So we need to just be careful. What we're seeing at the moment is of concern. We need to basically take measures to prevent it spreading. But even if it does spread, right, I think we need to be measured in terms of how we actually react. Like I said, it's only 15% of people that become ill from this virus that develop severe disease. 15%. And the majority of that 15% are individuals that have got other comorbidities, very elderly individuals. So there's a specific group of individuals that unfortunately are at heightened risk of developing severe disease. For the other 85% of people that are becoming infected, they have very mild symptoms. The 7 cases that we've now diagnosed in South Africa, none of them have actually required hospitalization. They've got mild symptoms, as I would get if I were to be infected, because we don't have the sort of underlying medical risk conditions that predisposes us to developing severe disease. And other than that, the other important thing that South Africans need to take really seriously at this point in time is we don't know how this virus is going to behave together with influenza virus. Right? We've got an intervention against influenza. Influenza starts circulating in this country around about May, June, July. The influenza vaccine is going to become available at the end of this month. Right? And it's absolutely essential, especially those individuals that we're talking about that have got these comorbid conditions. They need to be vaccinated against influenza.
Is it possible to get immunization against the virus?
Not against the coronavirus. Against influenza virus as a vaccine, like I said, that will be available in the pharmacies in the beginning of next month. And if people have got comorbidities, in fact, everyone should be getting vaccinated against influenza, but especially those individuals that have got comorbidities. At the start of your insert, you mentioned the issue of individuals that are living with HIV as well as those with tuberculosis. Another important group that even when they're on antiretroviral treatment, individuals that are living with HIV still got a greater risk of developing severe influenza illness as well as dying from influenza compared to individuals without HIV. So those individuals, the 7 million individuals in South Africa, need to also be getting the influenza vaccine.
Thank you so much, Professor. That is Professor Shabir Mahdi from the University of Witwatersrand.